Okay, so we'll get started. It looks like the number has paused the climbing, but I know we'll have some folks who are going to join us already in progress. So welcome everyone. Good afternoon. Happy Friday. We are very excited about this talk. We had initially started planning for this back in September, finally got a date that worked well for everybody. So we're really excited to share this presentation with you today. We have three distinguished researchers who will be with us, and I'm going to briefly introduce them and save time most of the time for the presentation. I would ask that if folks have questions, please add them to the chat. And in order to make sure that we get through all the material, we will hold those questions till the end, but I assure you we will either answer them during the session or as needed for follow-up, we will get back to folks. So getting to our presenters. So first up, we have Dr. Linda Fleischer, who I'm very excited, a double owl, and her PhD here from within the College of Public Health. We are very proud of that. So it's great to welcome Linda back to the college. Linda is a research professor at Fox Chase Cancer Center with a focus on health communications, health disparities, and as you'll see today, health implementation sciences. She has over 35 years of experience in intervention research and has developed and provided oversight for oncology programs focused on the intersection of health disparities, intervention development, implementation, dissemination, community and clinical partnerships in real world settings. So very, very practical application. For the last 17 years, she's led the regional NCI Cancer Information Service, being able to address cancer-related inquiries, including clinical trials. So for those of you who may have an interest in work in clinical trials, feel free to reach out to Linda. Having served over 500,000 callers with a robust partnership program collaborating with community-based organizations on clinical trial education. She also founded Fox Chase's Community Outreach Program and Resource Education Center, now known as the Office of Community Outreach. Next up, very familiar to many of you, our very own Dr. Gabby McLaughlin, who is an assistant professor in the Department of Social and Behavioral Sciences here in the college and the director of the RISE Lab. Gabby's research uses implementation science and health equity approaches to improve the delivery of health promoting policies with a focus on socially and economically marginalized populations. She collaborates with researchers and practitioners within the United States and has a global reputation and collaborates with several international partners. And last but certainly not least, Erin Tagai is a health services researcher who focuses on the development and implementation of clinic-based strategies to improve outcomes across the cancer continuum. Her lab works to address three key areas, including the development and implementation and evaluation of patient-centered mHealth interventions, adapting evidence-based interventions to routine clinical care using implementation science, and identifying and addressing social determinants of health associated with patient-reported clinical outcomes. So I will turn it over. I will just give everyone a heads up. We will be dropping a range of resources and links into the chat. So just keep an ear out when you hear the presenters referencing something. We'll be dropping those things into the chat. Just make sure that you download them before the presentation ends, and that way you have all the information. So ladies, I will turn it over to you.
Thank you, Jen. I'm going to go get my screen ready and get our slides up. Okay, I think everyone can see, but let me know if you can't, and I'll just pause for a second. But
yep, all set.
Good. Thank you. So thank you for those introductions. As you might know, I'm Gabby, and I'm a faculty in SBS, and then Linda and Erin are my amazing colleagues from the Fox Chase Cancer Center. And today we wanted to really give a extremely high-level overview of some of the work that we're doing in dissemination and implementation science, which is a rapidly growing field that seeks to accelerate the pace from which we go from evidence-based practices to real-world application. And so I think this really resonates with a lot of faculty in the college because a lot of you are doing probably D&I adjacent work, or we joke that it's D&I light or diet D&I. And we want to make sure that we give a bit of introductions to some of the work that we're doing. And then also, we also did a survey last year to try to collect some of the needs and interests of faculty across the college and also Fox Chase to see where the gaps in understanding are, and then also how we can actually build capacity. So we do have some calls to action at the end of this call, which Linda and Erin will go over. So we'll go through a quick implementation science overview. I think many of you know what D&I is, and so it's very quick, like 2 slides maximum. and then a couple of applications to public health. So I'll just review some of the projects that I'm leading right now. And then we'll talk about some of the amazing work that the Cancer Centre is doing and how our work group aligns. And then some future directions for how we can build capacity across Temple and Fox Chase. So obviously, we talk a lot about the research that we are publishing or presenting at conferences. A lot of the time, I think researchers get stuck because they have these amazing interventions that we test in randomized controlled trials. And unfortunately, we're not able to have the skills or even the capacity to scale that, either scaling up, in terms of reaching large populations, or scaling out to a new population. Sometimes we have evidence-based interventions or practices that are effective, but they're effective within a particular population. I think we can imagine what those populations look like, and oftentimes we're unable to make them sustainable and impactful in the real world. So again, we should be doing something with all this research. There is a leaky pipeline. So a lot of experts in D&I that have come before us have really tried to sort of conceptualize why there is a problem with translation. And so as you can see on the left-hand side here, we have original research evidence. And if we think about what actual evidence gets put into peer-reviewed articles, how research gets synthesized into meta-analyses or review articles, if any, what research gets formulated into guidelines for clinical or public health practice, and then what of that guidance gets absolutely implemented. It takes around 17 years for only 14% of evidence from research to get utilized in practice, and therefore to benefit populations. And this just isn't good enough. And so I think a lot of the work that we do is trying to work in a more pragmatic way to address some of these gaps in the pipeline. So if you can think about a practical definition, the key goal of implementation science should be to study the development, spread, and sustainment of programs, treatments, guidelines, and policies that are not only impactful, but are contextually relevant and robust, and that are able to be implemented across a variety of settings. And then also thinking about this equity lens of how do we actually implement so that we don't cause further harm to minoritized and marginalized populations. So in simple terms, I love this slide. It's by a mentor of mine, Jeff Curran, down at Arkansas. When we think about very non-scientific language that we can use for people who are just getting started for the first time, our intervention or our practice is the thing, right? So if we're doing a tobacco prevention intervention, that is our thing. And so when we do effectiveness research, we're trying to see if our thing is working compared to a control or a comparison group. Once we have that, and once we feel like we have good evidence, the implementation research helps us look at how best to do the thing. And then thinking about how do we actually test methods to improve us doing the thing, that's where implementation strategies come in. And so we think about, and I'll discuss some of this in a minute, and I know that Linda and Aaron are doing some amazing work as well. We think about ways to improve implementation, and it's not always coming up with a new intervention. It's coming up with ways to bolster what's already happening to make that a much bigger impact. And then again, implementation outcomes, how well and how much we do the thing. So reach, uptake, effectiveness, feasibility, cost of implementation, all of these things that we care about and you probably are already looking at, these are helping us to understand how well did implementation go, because that can help us sustain. Now, thinking about an equity focus, a lot of folks over the last few years have been able to start putting out some guidance and calls to action for many people in implementation science, public health policy, clinical care, to really address equity at the very beginning of designing these interventions and at the very beginning of starting to implement. This is a really big gap in the field, I would argue, in public health in general, but especially implementation science. And so again, how can we address some of these gaps through really careful research that's done at a local level, at a national level, and then thinking more internationally as well. And so I'll just kind of go over some applications to policy real quick, because that's where my wheelhouse is. If we think about policy implementation research, it's kind of at the far end over here where we already have policy making and policies that are established and implemented. But how can we look at the downstream impacts of policy implementation and use that information to guide how we then create more policies? And so I try and kind of sit myself in this area because I know I can't control a lot of this stuff, especially with recent events. But how can we look at what's happening on the ground in practice to help inform changes to policies or adaptations or even new policies to be established? And also my question to you is, if it takes 17 years for only 14% of research to be put into practice, how much longer is it going to take us to get actually impactful results when we look at marginalized populations? Oftentimes, implementation as usual, or what we see as implementation happening, fails to account for misimplementation, which can cause further harm, or a lack of equitable implementation whereby we don't give the same amount of care or same treatment to populations that are most in need. And so we're unintentionally furthering inequities by trying to think about just the overall outcomes of our work. And so I'm trying to just urge the group to think about how can we see implementation science as a vehicle to help us get closer to health equity. So here's some applications. I'll just breeze through a couple of examples. One of the policies that I focus a lot on is universal school meals. And so this is a policy called the Community Eligibility Provision that the USDA is funding. And so any school within the US and any district that serves students whereby more than 25% of them are low income, they're able to serve universal breakfast and lunch for free, and also after school meals. This is a key policy in systems environmental intervention that can help us actually address some of these inequities in food insecurity by uplifting those who are most marginalized. But there are implementation gaps, right? So this policy is my thing. How do I improve implementation and then also outcomes of my thing? So this is really what I'm going to be focusing on for the next few years. I'm 2 years deep into this KO1 award. I will briefly walk you through. I realize it's very, very brief, just the design of this project, just for time's sake. But basically, I'm using a method called implementation mapping. And so if any of you have done co-creation, if any of you have done co-design or community-based research or user-centered design, it's very, very similar. In essence, we're starting with the needs and assets of the settings that we're actually working with to build the intervention together. Now, we already have the intervention. We have the thing, which is universal school meals. Now, how can we build an implementation strategy to help improve uptake of school meals in these schools and also improve delivery and implementation? And that's split up into 5 different tasks. So basically, I kind of put these into different aims of my KO1. So the first year we focused on just getting a lay of the land needs assessment, and we utilized different frameworks for that. I'm not going to go into that too deeply because I don't want to overwhelm you. And then this year, we're kind of taking that needs assessment data and we're building implementation strategies with the schools involved in our project. This is taking a long time purely because it takes a while to assemble your representatives to try to get a structure in place and then also be able to kind of slot in among the different priorities and needs of these schools that are serving predominantly marginalized populations. So once we have our implementation strategy, we're going to test it out in a hybrid cluster randomized trial. And I'll walk you through what that looks like. So essentially it's assess, develop, test, okay? Or plan, do, study, act, very simple. But it takes a long time to really get the trust and buy-in of these sites. It can be done quickly depending what you're doing, or it can take a little bit more time if you know, the structures in place are a little bit more expansive than potentially one site or two. The way in which we can accomplish and the way in which you guys can start to think about how I can move more implementation focus of my work is trying to consider or even entertain the idea of hybrid trials. And many of us are kind of doing that in our research to some degree. But basically, it's taking the idea of you doing your randomized control trial, publishing that paper, and then doing your process evaluation paper and publishing that one, and trying to merge them. So we're focusing on implementation and effectiveness within the design of our study. And implementation takes a front seat as opposed to a back seat after the fact that we look at, you know, our health outcomes. And so I'll just guide you through real quick this conventional idea of the RCT over here. And then we have hybrid type 1, 2, 3, and then full implementation trials we can look at. You do not have to start from this end and work your way incrementally. And depending on how much research evidence you have that your intervention could be effective, you could potentially start at type 2 or type 3. I'm doing a type 3 because I'm predominantly focused on implementation outcomes. We have a good amount of evidence as to how effective universal school meals are, but there are implementation gaps. So that's where I'm predominantly working with my KO1. Lots of folks who are just starting out probably opt for a type 1 or type 2, because if they're trying out a new treatment or a new approach or working with a whole new population, this gives you a primary focus on the public health outcomes and then a secondary focus on how that actually gets implemented. And there's different ways to design those, and we haven't got a ton of time to go through that today, but we're happy to help you and think through that in more clarity as well. So as you can see, it's more controlled to less controlled, but once we get over here, we're trying to make it a bigger real world impact. We're trying to scale and we're trying to sustain. And one of the things that we can do is when we do our needs assessment, so our assessment piece, is trying to utilize different frameworks. So here's just one example of one snapshot of findings from the needs assessment. And as you can see here, what we tried to do is understand determinants to implementation of school meals through the lens of the Consolidated Framework for Implementation Research. That's a widely used framework, and it basically just helps us to compartmentalize barriers and supports into what's happening outside the school, inside the school, among individuals in the school, the innovation itself, and then just how is implementation going, period. And so as you can kind of see, we can begin to structure our data in a way that just helps us organize our findings better. It really is just adding structure and adding some pragmatism to our data. You probably already have data like this collected. It's just trying to figure out how you actually organize that and utilize it to drive that co-creation of your intervention. And so just kind of a highlight as to what's happening this year, we're using health equity and implementation science frameworks with our schools to build the protocol for how we actually design that implementation strategy. And so as you can see here, here's the framework. And this is just to show you that we can use multiple implementation frameworks and incorporate behavioral and policy systems, environmental frameworks to really harmonize and adapt to the study that we're trying to do. The nice thing about implementation is you don't have to just use one framework as if it's more of a behavioral approach. We can kind of combine the best elements of different ones, because the whole point is that it's going to be externally valid and valuable to the work that we're doing. There's two more quick sticks I'm going to show you. So one is a equity focused measurement development tool. So we got funded by the Urban School Food Alliance to basically co-create survey tools to assess implementation determinants, so barriers and supports, processes, so how's it going, what are some of the challenges on the ground, and then implementation outcomes. So I mentioned those before in terms of like feasibility, appropriateness, feasibility, cost, sustainability. These are really important outcomes that allow us to explore whether or not our intervention is successful at being implemented. And so I think the link is in the chat for that paper for you guys to read about how we can create implementation measurement tools. But the whole goal was to help people stop reinventing the wheel when it comes to measurement. There are so many homegrown tools we have out there that just don't get used more than once. And so it's really hard for us to have a common understanding of what's working and what's not, especially when it comes to policy implementation. Oh, sorry about that. Clicked too far. Sorry. We are disseminating these measurement tools. So we have a NCI contract that we just finished up where we created this toolkit for folks to take these tools and adapt them. And so again, a lot of implementation science is about creating measurement tools or other tools for folks to take and adapt so that we can reinvent the wheel, avoid reinventing the wheel each time we try to do something new. The last thing I'll just kind of briefly mention is we have implementation science, and often the dissemination science gets left behind. And so this is one pilot that we got funded through the Washington University St. Louis Medical School, funded by NIDDK, which basically allowed us to not only develop and recruit and retain a community advisory board, but then also go through an iterative dissemination design process with them, so that we are essentially thinking about dissemination in the very beginning of our project. And then that allowed us to co-create products that weren't just focused on a peer-reviewed paper or a presentation. And I know that that's our currency in higher education, but I'm hoping to kind of introduce some ideas in which we can kind of move away from that as being our sole implementation outcome or our sole dissemination product. And so as you can see here, it's an iterative process, and my colleagues at WashU have made this online planner, which is really cool. If you type in D4DS planner here, you can kind of see it. But basically the goal is that we slowly get your partners on board. So whether you're doing research with people who have diabetes, people who want to get organ transplant, thinking about your partners and your community collaborators, how can you create a group of people that can help you co-design this product? Thinking about outline the problem. So where the problem is just lack of uptake or lack of engagement with your projects in general, also lack of awareness with people knowing about what your intervention is or what your team does. Try to grasp the context of thinking about how you can actually improve the awareness, and thinking about, if you're working in Philadelphia, what are some of the main barriers to care in that population? And then whoever you assemble to help you, confirm and code on your product, establish a dissemination plan, whether it's a series of webinars or a research brief or a social media toolkit. And then you can actually assess how well that dissemination plan is being executed and try to see what the reach of that is. And then you can plan for sustainability and then evaluate. So you can see who read these materials. Has anything actually changed? Do we have better uptake in our studies? Do we have better trust with our community partners? There's all kinds of ways you can actually do this, but it's a really helpful way to think about how we can design for dissemination and not just wait till the very end of our study and go, oh, here's a PowerPoint or here's a flyer. And it makes it much more of a meaningful and central focus to our work. So just two examples, we created this report from our needs assessment, and that was passed out throughout the whole district. And then we created this research brief or community infographic, just to kind of showcase and illustrate some of the main findings that we saw from our needs assessment. It's also really helped to recruit new advisory board members for our CAB. And then it's also helped to just maintain trust with schools. They can actually see what we're doing with the data, and they hopefully are more inclined to remain involved. And then all of these are on our website that we just developed as well. So feel free to go and have a look at that on the Temple website. It took us a long time to create, and one of my students has been amazing at helping me kind of formulate this and get it come to life. And then here's our CAB that supported this process. So we're really thankful to them and their for their efforts, and we are going to be maintaining them for the years to come. So the last slide before I hand off to Linda and Erin is just to highlight the messiness of implementation. We tried to sort of think about how best to conceptualize this sort of behind the curtain slide, or just to think about, yes, implementation science is great and it's exciting and it kind of adds a lot of flavor to people's, you know, grants and publications. It's just, we also want to make sure that people know all of the steps that it really requires outside of doing a potentially more controlled or more discrete study. And so I think, you know, in some of these steps we tried to put together, we tried to think about how many things we have to think about as implementation scientists before we actually get to do the thing. And so partnering with sites, so it's obviously, as people know, working with schools is challenging because they have so many demands on their time. Erin can also relate to just working with clinical sites as being challenging because, again, different demands, health insurance issues, lots of other red tape, trying to meet with people and get them excited about the project, trying to think about, are they ready for this project, or is it going to actually make them more stretched and more overwhelmed? Thinking about co-creating these strategies and interventions, it takes a long time to do this in a meaningful way that isn't just us coming in with an idea and then asking them to do it. Thinking about palette testing these, trying to build a protocol together, and then thinking about how you know, in all that time, you might have sites that drop out and you want to re-engage them and also build capacity at the same time. And then when you're ready, hopefully you can actually do the thing. So this isn't to put anyone off, it's more just to try to think about some of the things that we have to build and build time for that in our grants and projects. Okay, so I will shut up now and I'll hand it over to Linda and Erin.
Thank you, Gabby. That's great. And I think just so highlights the sort of different ways in which we can think about how we integrate implementation science into our work, as well as sort of the research questions that we really want to be thinking about. And I think for us, and speaking a little bit for Erin and I, but Erin's going to kind of walk you through a little bit of what we're currently doing. You know, there's implementation science going on at Fox Chase as well. And I think one of the things that we've really been thinking about, and I think the other thing to say is implementation science really is a team sport. It really is not sort of reliant on one leader, one PI. I mean, I think Gabby, as you so well described, I mean, it really is about these various relationships and really understanding the context of the work that we're doing in the research. And I really want to give a shout out to Erin, who has been part of this work group and now leading this work group for the last, I don't know, 8 years. We took a little break over COVID, like many things, but really it's a small group. But I think what we're trying to really begin to look at is how do we better understand what is being done in implementation science in either both in research or in practice? Because I think that's one of the exciting things to me about implementation science is it can drive program planning as much as it can drive research. And it's really utilizing those methods and those approaches. So this is a small working group that we have at Fox Chase. And again, as we get to know Gabby a little bit and the work that she's doing and some of the work that, her mentorship out of WashU, we kind of reached out and asked her to join in as well. And we have Allison Brecker, who's in my group, who's a postdoc, our research assistant, and then Zach Frosch, who is one of our medical oncologists. So we're really excited about Zach being involved, really bringing in that clinical perspective as we begin to think about, I'm going to focus a little bit on the survey, but I think just to, what we're trying to accomplish in this work group is really bring researchers together that are both interested in doing this work so that we can share ideas and share insights as to the work that we're doing. But it's also to provide resources and again, that beginning to be a resource to others as you're planning your projects. So Gabby, next slide. And so we conducted a survey, again, to better get a sense of, well, what are other folks doing out there? Where do they see themselves within dissemination and implementation? Are there others that we really need to draw into this work group, or as we think about projects we need to be reaching out to? So that was really the purpose of doing this survey. It went out to Temple Public Health, the college faculty, Fox Chase Cancer Prevention and Control, and our Fox Chase clinicians. So it did not include the medical school, and that's actually the next step that we want to do, is to actually also have this sent out so we can get those perspectives. And the questions really focused on kind of, where are you currently in terms of dissemination and implementation research? Where's your interest? As part of this too, we actually had really wasn't a true white paper, but kind of a document that really provided some of the definitions and gave examples, because I think when you say implementation or dissemination, people have very different perspectives of what we're talking about. So we wanted to make sure that we laid out from the work group's perspective these definitions for people to respond to the survey questions. Next slide, Gabby. And so I'm just going to highlight some of the results from the survey, because I think they give us some insights into where we need to grow. And I think, and Aaron's going to talk a little bit about some of the recommendations that came out of the survey. So as you can see here, we have about a split, about half are saying, I am really not that interested or necessarily yet that interested in doing implementation science and research, but we do have the other half who are either using concepts. So again, it may be in that planning phase of their research, they're looking at these frameworks and thinking about the frameworks. They may actually be having exploratory aims. So again, going back to Gabby's hybrids, it may be they're a hybrid one, but have some exploratory aims there that begin to look at the context. How will this be implemented if it's moved out into additional research or into practice? And in terms of dissemination as well, it looks pretty similar. So next slide, Gabby. And we can come back to these if people have questions. I think we want to more just give you a sense of where people are. So we asked them then about your current portfolio, not just are you interested, but what are you currently doing in this space and in this research? So again, almost 40% said it doesn't really fit in their research, which we're so glad they answered the survey, because this is important for us to really understand, right? There again, I think where the majority are utilizing concepts, thinking about the context. You can see there's sort of more limited in terms of faculty actually beginning to do really the researching the thing, as Gabby had said earlier. But there is a lot of interest in this. And I think, again, opportunities to really build out our research and also build out sort of the expertise in implementation and dissemination. Next slide. And then this is just a breakdown of, again, your current projects with the D&I focus. Again, majority, no, but we have about 20% who said, yes, I actually have projects with this focus. Many of them are funded, and that they really see that. Again, few, about half of those who said yes, primary aim, and you have interventions, because this is the other piece that I think is really important, is do you have interventions that have been proven already to be effective? That there's that kind of, valley of death almost, like as we think about innovation, where I have an intervention, I've done the efficacy trial. I may even have done an effectiveness trial, but the resources to take that next step to really look at it from an implementation research perspective is pretty challenging. And I think it's trying to begin to help us, for those who have those interventions, to really think about, well, how can I now move this into more implementation research? And I think that's where there's a lot of opportunity. Next slide. And so I'm going to turn things over to Erin, who's going to talk about the recommendations that came out of the survey for moving forward and some of the research projects at Fox Chase that that you may be interested in following up with some of the various faculty. So Erin, turn it to you.
All right, thanks, Linda. Yeah, so within our survey, we did also ask the respondents to identify tools or resources that would help them as they want to learn and explore D&I and what it means for their research, and really get down to specifics of what we should be doing and can be doing both at Temple and at Fox Chase to support the research. So our first recommendation is to facilitate networking and new collaboration across campuses. So, we're thinking that if we can link people together through a matchmaking program where we can survey individuals for their expertise and match people who have not worked together. So we know there's a lot of individuals at the College of Public Health who are doing work that's, kind of adjacent to work that Linda and I are doing and others here at Fox Chase, but we're not crossing paths. And, we have some of that methodology experience and implementation and dissemination, and being able to link people together who otherwise would never be talking to each other is one way to really move this forward. We also want to identify outside collaborators and consultants with dissemination implementation expertise. Also, these people can help to review grants and consult on proposed and ongoing research activities. We know from our own experience in doing implementation research and submitting grants, particularly to NIH, it can be very tough for a D&I review panel. They're sticklers for, what this should look like and how do you integrate frameworks. And so bringing in these outside collaborators and consultants who have extensive experience in this will help all of us, and particularly people who don't have experience, to obtain funding. And then also to develop an external website accessible to faculty across the campuses to access researchers, including a list of our investigators who are interested in D&I research and their expertise. So again, you can do some of that matchmaking yourself. And then funding and training opportunities both across the Temple system, but also locally and nationally. And then relevant seminars and publications. Our next recommendation is a dedicated budget for D&I training consultants and pilot grants. So, there are a lot of opportunities for D&I training. And so if we can provide funds for individual researchers to go and pursue those activities and seminars or bring them here, that would be great to help further all of our research activities. And then also funds to reimburse those expert D&I consultants for grant review and consulting. Their time is worth a lot of things. We want to appropriately reimburse them. So if we can have dedicated funds where we know if maybe you're working on a grant or a new idea that involves D&I, and we can bring them in and have funds to reimburse them for their efforts. And then also some pilot grant funding to support new collaborations and studies across the campuses. So as we're making these new networks and collaborations with individuals, we want to have actual pilot funding to support these new ideas that can obtain funding to go on for further success with NIH funding or other funding that might be. And then lastly, we want to look at statistical training for D&I studies. So that these studies have very unique statistical needs. So you're not just looking at the individual participant level and seeing, you know, how much did we reduce tobacco usage, or, you know, how did we increase cancer screening, but you're also looking at the organizational and other system level factors. And you want to be able to analyze how well the intervention was implemented, what was the dosage, how many providers adopted the intervention. There's a lot of aspects to this that add some unique statistical needs to these projects. And so in our own experiences, you know, we've had to, our statisticians are great, but we've had to do some of our own training with our statisticians to introduce them to our frameworks and what that statistical approach might be. So if we want to bring on training and resources to support quantitative and also qualitative analyses across campuses, and I'll talk in a minute about some of the qualitative research I'm doing and how we can bring in qualitative and D&I together. And then we also want to establish a list of internal and external statistical consultants to advise on very specific specialized analytic techniques. For example, on one of the other studies I'll talk about in a second, I'm working with Dr. Suzanne Miller here, and we also have some other sites at Rutgers and Jefferson we're working with, and we're using a SMART design, which is a very specific technique. And so we have an expert who many of you probably know, Donna Kaufman, who was at Temple and is now at the University of South Carolina. And she is who we call our SMART person on our grants, because she is leading all of that statistical analysis. So we had to go externally from Fox Chase to find someone to fill that gap for us. Next slide, Gabby. All right, so within the survey, we also ask individuals to identify the studies they currently have ongoing that are implementation related, or maybe it's just ready for a D&I study. You have that evidence-based intervention, and now you're wondering how you can take that to the next step. So first, a couple examples here. Dr. Lillian Shin-Cho is one of our newer faculty members here at Fox Chase, and she has a she's in the R00 phase of her K99 and has a positive activity intervention for Asian American patients and caregivers. And this is an evidence-based intervention and is primed and ready to go for an implementation study. So maybe that is that hybrid one design that Gabrielle talked about, where you have your effectiveness as your primary outcome, and then you're looking at your implementation outcomes as a second aim. Dr. Betsy Plimak is our clinician here, and she is looking at care plans for common treatment regimens. So really clinically applied studies going on to see how they can improve quality of care here. And then Linda has projects focused on tobacco treatment and increasing cancer diversity in clinical trials. And then I have a qualitative study where, you know, we have a lot of quantitative analyses for implementation, but we can also use qualitative research really effectively to get a really in-depth understanding of those contextual factors that are going to impact implementation. So for this, I have interviewed both patients and then our clinical providers here at Fox Chase to get their understanding and perspectives on the evidence for prostate cancer treatment decision-making. And so we're using the CFIR framework, which pulls in those 5 domains to guide the assessment of barriers and facilitators for implementation to really understand, you know, how they view the evidence base, how able they are to make changes and implement new guidelines into their clinic. And through this, I can get a really in-depth evaluation of what it will take for me to help the providers then implement new guidelines and develop interventions to improve decision-making for treatments. And then we also have 2 other studies here focused on enhanced colposcopy attendance and shared decision-making for prostate cancer treatments. And I'll talk about those on the next slide, Gabby, if you could. So here we really wanted to go a little bit more in depth on some of these studies to show you the frameworks that we're using and the funding status for all of these. So You know, a lot of these started out with evidence-based interventions, your traditional randomized control trials or other pilot funding, and they've moved to a stage where we were able to obtain funding specifically for the implementation study. So Linda and her colleagues have their My Choice implementation study using the CFR framework, and it's funded by Genentech. There's also their tobacco treatment program evaluation here at Fox Chase, which uses the REAIM model. This is our very classic implementation model that a lot of us use that focuses on the reach of the intervention. So how many participants are you enrolling, your efficacy or effectiveness, depending on what stage you're at, to really look at, are you still getting those patient level outcomes or whatever your primary outcomes are? How many clinic sites or providers or schools adopted the program, your implementation, so how you are, what was the fidelity of implementing this project or the intervention, and then your maintenance. So are you able to actually sustain this after you pull away your research staff? And then also have the accelerating and diversifying access to clinical trials. And this uses CFR program sustainability and systemic capacity. So integrating different theoretical underpinnings for this. And this was funded by Stand Up to Cancer. I am collaborating with Dr. Suzanne Miller here, as well as at Rutgers and Jefferson, for this hybrid type 1 trial, where we're focusing on getting patients who had an abnormal cervical test to their colposcopy appointment. So this is a text message based intervention where we have, so Dr. Miller previously had developed a telephone counseling intervention that was found to be efficacious, where they increased the number of patients who came for follow-up. And so we now adapted that for text message to reduce demand on resources. With a telephone, you have to have staffing in your clinics to be able to call participants. Also, no one wants to pick up their phone, so you're not even getting people who are answering their phones. And so we found that text message was a really, you know, an ideal method to get this intervention out to patients. And so we're using the PRISM model for this, which expands the REAIM model to include contextual factors that interact with an intervention. This was funded by NIMHD, the National Institute of Minority Health and Health Disparities. And so our primary outcome is looking at, you know, how many people we get to their appointments. And then our secondary outcomes are all focused on implementation outcomes. And then another study we have is a type 2 model. So this, we have our primary outcomes are both the effectiveness as well as the implementation outcomes. And this is another intervention that we had developed with Suzanne Miller here and Michael Diefenbach at Northwell to elicit you know, patient preferences when they're deciding which prostate cancer treatments to get. And so now we're trying to get this work into the clinics, both here and at Northwell. And then Gabby has a couple down here that again use CFR and health equity frameworks that were funded by NHLBI and NIMHD. And then next slide, Gabby. All right, so this is our last slide. So what are the implications and opportunities for D&I research? So as you just saw, we already do have a lot of projects and expertise going on at Fox Chase and Temple, and there are more Temple projects that I didn't list on this that we have expertise. And so really there's a lot of opportunities for networking and collaboration across the sites. And, you know, Linda and Gabby and I are really able to serve as methodology consultants. So maybe you are thinking about how you move your evidence-based project to the next stage, or maybe how do you start thinking about getting some pilot data together to see how successful implementation might be. This is something that we're willing, you know, to talk to people about and, you know, figure out how we can help you move that along. And then, you know, we have our working group, and we would love to have more individuals join our working group, particularly from CPH. So if you're interested in chatting with Gabby or Linda or myself and seeing how you can get involved, you can absolutely drop your name in the chat and we'll reach out to you. We also want to help to build out more resources as we pursue, you know, filling out some of our recommendations. So if you have ideas or things that you want from us or that we can bring to leadership, absolutely let us know and we can help get that started. And I believe that's all. So we'll open this up for questions.
Great. Well, first of all, thank you very, very much. And I'm sure all of our audience will join me in the virtual round of applause. I think that was really great. And thank you for all the resources, all the information that I was dropping into the chat. These were all resources that we carefully curated to make sure that I was dropping them in the chat at the right time related to the slide. So thank you to all of our presenters. So I will remind folks, if you have questions, please feel free to drop them into the chat. And so the first question, and we've got about a little less than 15 minutes for questions. The first question that came in was to ask if this approach worked in a global community. So a lot of the work that you were talking about was in a domestic context, but can you address that working in a global context?
I can start, and I think, probably Gabby and can add in. I mean, from a implementation perspective and from an NCI perspective, National Cancer Institute, there's a whole group that is just focused on global implementation. And so I think if that's an area of interest, I would definitely recommend going to the NCI site, implementation science, look for their various collaborative groups that have been developed through that program, and bringing people together with very like-minded approaches or populations. And there is a whole group that's just focused on global implementation science. I've not done that personally, but I know that there is a lot of work going on in that area.
Yes, I will just add, so global implementation science is a big thing, and the NIH actively funds work that's happening to partner with researchers in the US and then countries in the global South. And so when I was reviewing for the implementation science study section at NIH, I'd say almost half of the applications were for collaborating with countries that were in South America, Africa, Southeast Asia. And so there's a lot of focus to, and these are things like, hand washing, interventions that Graciela, you talked about in the Public Health Beyond Borders group. So I think we could definitely talk about potentially collaborating with some of these groups that you work with, because there's definitely a lot of priority placed, at least right now, on some of this work. And then there's also centers that I just dropped in. So one is at NYU. UW has a really good global implementation science focus. So there's work being done all over. I just haven't been able to get funding yet to do some of this work, but I definitely have collaborators that I'm trying to work with to get it done. So yeah, there's lots and lots of appetite for this, and there is some funding too.
Great, thank you. And Gabby, I wanted to go back to something that you said early on in the slides that was really, really striking, that 14% number in terms of what we're seeing, what we're studying, and what's actually making it into practice. And so I'm going to take the liberty of being the moderator to ask a question that I want to know. So how do we, you talked about the policy piece, and I'm thinking about it in terms of policy makers, whether we're talking about elected officials or we're talking about, at a place like Temple University, talking about leadership within the institution. How can we do a better job of helping them to understand this? And I know that may be stare into the crystal ball, and I'm asking a tough question, but just wondering what your insights are based on the experiences that you've had so far.
I will say that I've had a little bit of a fortunate time in an unfortunate situation when COVID was at its highest, and we were having just a lot of calls with the USDA and the CDC about how best to implement, school meal pickup sites. And one of the nice things was that in an awful time of crisis, at least the groups that we got to work with were really wanting rapid cycle research. Mm-hmm. And I think that there's a lot of rapid cycle implementation research that's taking place. So for instance, I'm learning something called rapid qualitative analysis, which allows us to analyze some of these data in real time. And I think we just have to look beyond the peer-reviewed article, because that timeline is way too slow, and more into developing research briefs. And that's where I feel like the designing for dissemination piece comes in really handy, because we're able to disseminate our research in different ways. I know obviously it's not always the case when we have proprietary data, but I found that when we worked with people at the USDA, they didn't really want to read our papers. They wanted to sort of have data snapshots. They wanted us to present at least a few slides on what we're seeing in real time. However, I realized that was also a public health crisis. And so in other situations and other times, I really can't speak to how well that could be done. But there are groups, I know there's one at Penn State that I know is a really good one, like a research to policy, that are focused solely on trying to increase evidence uptake within the policy setting. I also know that the APHA does a really good fellowship where they actually put you in Capitol Hill and they match you with a congressperson. So know that that is also a really good way to increase the speed of like us getting evidence into the hands of policymakers. I've also, even though I've been a bit like against it, been more willing to talk with like Billy Penn or, you know, other news agencies to get little sound bites in there and get some of that, because surprisingly, one of my colleagues at WashU said that when she was on Capitol Hill, they spent the first 2 hours of each day reading the news. So I guess that was also a good way. But I think there's definitely more to do with the dissemination piece specifically.
Thank you. Thank you. And I do appreciate your point. I'm going to drop the link in the chat. The APHA fellowship is a great example. They're not taking applications right now, but I know there's a question that I'll get to in just a second about opportunities for students. So that was great. Thank you, Gabby. Another question that came in was, how important is it for identifying sustainable funding for a program as part of your implementation research? So the person asking the question said that on a recent application for an efficacy trial, the question of costs related to sustainability of the innovative approach was raised. So can you talk to that, the sustainability piece, and what are the resources associated with that, being able to sustain this?
Yeah, it's a really tough question in a way, I think, especially if, you know, you're talking about that at the level of collecting efficacy, right? I mean, we haven't even gotten past that point, but I think to me, it's a little bit of a couple things is really beginning though to think about that very early on, that, you know, what is going to be, what's the cost of development versus the cost of implementation, even in an efficacy trial, really being very clear about that, because I think, you know, those developmental costs may not follow through in the implementation, which will have different costs, of course. But I do think it's really thinking about upfront, is there a less costly way in which to provide this information or this intervention? Because that will become an issue as you go down this path of implementation. I think there's also thinking about, I think, being able to describe what are the factors that might impact sustainability can be another way of beginning to at least address that by collecting some information. And there is a framework out of WashU as well on clinical trials. I mean, clinical sustainability and program sustainability frameworks with assessments that I think even building those in early on, so at least you're beginning to plan, you know, what are going to be the things that might impact sustainability in addition to cost. So, and I know, I mean, you know, maybe Aaron and Gabby have more to add to that.
Yeah, I think, Linda, to talk to you, to expand on the piece about, you know, thinking ahead, how you're developing your intervention and what your channels you're using, like the one I talked about where it was originally a telephone-based intervention, and that would have required a lot of staffing. And, you know, how do you originally had the patient being transferred, a warm transfer from the clinic line to a research nurse here in our building to enroll them or get them on it. And it involved having to go through a whole telephone-based survey to identify the barriers. And now we're doing it via text message. And so I think learning now, like when I'm developing or thinking about other interventions, this lesson, I'm thinking, okay, do I have to do it this way? What's a better way to do it? Is this something, if we do text or maybe using it through, if it's through clinics, can I just automatically use the MyChart portal versus some external thing that's going to cost more money or a vendor? Like, what are the roots of this intervention that I can do now that in the long run will make it more sustainable, will make it cheaper, and all those little aspects that eventually build up to your intervention ultimately dying, or how you have to adapt it then later on for sustainability.
Okay, so we've got about 5 minutes left. So if anybody has any questions, please feel free to add those in. But really, please, a question that we have from one of the students who's participating today. Are there opportunities for graduate students at the master or doctoral level to participate? And are there any resources that students could access as a starting point? And I know we shared some of the resources in the chat here, but any recommendations for coursework or, for students to be able to get started, opportunities to come and talk with you about how to get started?
You can join my lab. So yeah, I would love to speak with anyone who's interested about getting more training. There are also, I know I talk about WashU because I was there for postdoc, but they're building a PhD in implementation science. And I know that we're talking about doing a very similar, like, interdisciplinary PhD here at Temple. I know it's obviously like down the line, but it would be nice to think about incorporating more coursework in our graduate programs that focuses on translation and implementation. So I'm not teaching a course on that right now, but I would love to create one. But yeah, there's also, like, there's my work. I know, not to like speak for Linda and Erin, but I know that they take fieldwork students to work on some of those projects. And so I think there's a lot of talk around just getting students involved in some of this. Yeah, and I'll post some more links in the chat for students specifically.
And I know
yes,
some students have to sign off for meetings or courses at 2:00. And I thank you, Kim. I just saw that you dropped the QR code for suitable points for any students who are participating. Please make sure that you click on that and get a screenshot of the suitable code so that you get points for the session. Linda, I apologize. You were going to say something.
no, I was just going to say, absolutely. We love having Temple students. And so for anyone who is interested in some of the work that we're doing, and they're doing an internship or looking for an independent study, to please reach out.
Great. Any final questions?
I'll just say as well, if anyone wants to get more information on some of the work that we're doing that's beyond what we posted, I'm doing a webinar for the Global Implementation Science Center at NYU on Wednesday at 9. So feel free to register. I can send the link out later, but that's going to give more in-depth methods overview as to what we're working on. And I know, hopefully, Linda and Erin, we would love to do a much more of a deep dive into some method stuff in the spring. Maybe a part 2 of this if we're allowed to come back and we aren't kicked out. But yeah, it'd be nice.
No, we had good attendance today. I think we will be pleased to welcome you back. So we've about 1 minute to the hour. I just want to take the time to say thank you so much to all of our presenters. We really appreciate you sharing your time, your talents, sharing some of the resources with everyone, and also being open and approachable for students to come and speak with you, or other faculty who are looking to learn more about this methodology coming to speak with you. So thank you all so much. Everyone, have a wonderful Friday afternoon. Have a great weekend, and we'll see you again in a couple weeks at the next seminar. Take care.